Elaine, you're good taking notes for today.
Yeah. Okay. Is that Stacy?
That's Carmen.
I mean Carmen. Yeah.
Yep.
Carmen. Right.
Carmen and Barb Schaefer are online.
Great.
Great. Okay, well, we'll call our Board of Health meeting to order here at 8:02. So first thing on the agenda here is approval of the minutes from our September meeting. Did everybody have a chance to review those?
Yes.
Any comments, changes?
I would move to approve those. Second.
Okay, all in favor of approving the minutes from September?
Aye.
Anyone opposed? Okay. Minutes approved. Next we have any old business, which I didn't have anything on the agenda. Was there anything that folks wanted to circle back to from previously? Then we'll move on to the new stuff. Okay, so some updates from the health department. We'll start with Marcia's going to give us an update on our flu and COVID immunization clinics.
Yeah, so far this season we have given 694 flu shots and 460 COVID shots, and that's from all of the clinics and in the office as well. And then I also did print off, because they did recommend anybody 65 and older should get a second dose of the new COVID booster at least 6 months after their last dose, and so I did just kind of print that off for everybody just to look over, because it's kind of wordy. But essentially, everybody 65 and older can get a second booster in 6 months. That's their recommendation. It's pretty straightforward. The other update would be for the pneumococcal vaccine. They did change the recommendations from 65 and older to 50 and older for everybody to get. So we're getting quite a few people to come in for that as well.
Which one was that, please, Marcia?
The pneumococcal. So any of the pneumonia vaccines.
55?
50 and older.
50.
Yep. 50 and older now. And I think
And that's, which vaccine they get is still the same recommendation, so it's either a Prevnar 20 or it's a combination of a Pneumovax.
so they're recommending everybody either get one of the newer pneumococcals. So the Prevnar 20, the 21, or the 50.
Or the 50. Okay.
Yeah.
But no, for the Pneumovax degree, not for people 50 and older.
It does say that they can use it, like if you get, like you were saying with the 13 and the, yeah. If they get like a 15, they should still get a 23 a year later. Yeah, it's kind of
Pneumonia recommendations have really
Change
changed
every
a
year.
lot in recent years.
So is that a regular one or is that a?
No, it's 1 to 2 in your lifetime.
Yep. Yep, and then you're done.
Depending on which ones you get.
Yes.
Yeah. Great. Any questions about immunization clinics? We had a very, very busy October, and the first couple of weeks of November, Marcia's days were pretty well booked with people coming in, and it has, we're still getting people that are coming in for flu and COVID vaccinations, but it has slowed down a lot now.
Quite a bit. Yep.
You still have RSV vaccine available?
Yes. Yep, we have a few people coming in for RSV. If you got it last year when it came out, they recommend just to keep going at least 2 years or longer for the RSV.
How did flu and COVID compare to last year in terms of number of shots?
I did not compare it to
What was
last year.
number? How many?
694.
Okay, so that's a little down from last year. I think we were right around 800 last year.
Yeah.
But, we may still, I didn't think that was all season last year, so we may still get there because people will still come in for flu shots.
Yeah.
And I'd say the COVID, I think we were about 500 last year, so that sounds, we're pretty.
Yeah, we're 460, so we're right in there.
Yeah. And we again used our electronic health record to go through our shot clinics. We did attempt to do some pre-registration this year, which didn't go very smoothly. But we've learned from it, and I think we'll be able to continue to kind of improve our process going forward. The one thing I will say is, while I know there's a lot of people that are not thrilled about signing up online or, doing all of that information electronically, it does make all of our back end stuff much, much faster. And I'll let Katie talk about that a little bit along with kind of the billing update for where we're at with things. I think, when did you finish getting flu shots billed?
October 31st.
Yeah, which, I mean,
Amazing.
before we had an electronic health record, we were billing flu shots into March and April. So, vast improvement on our end.
Not the ones who got shot.
Yeah.
For me, it was a huge difference. These are last year's and this year's reports to this point for collections for our billing. So usually it takes me a minute to get after flu and COVID season, I've started fixing the ones that haven't been paid out. And then my goal is that they're all at least at 90% return by the end of the year. Cindy, you want one?
I go.
You got it.
Actually, maybe I will take one to hold
Here,
it
I've got extras.
Carmen here and Barb. Thank
Yeah. So one's for 23, one's for 24. So 23 is obviously almost closed out because there's like a year for fixing things. The two that are left for December are Cigna ones that I've been working on fixing for a year and that are supposed to be fixed. So I have to just do a follow-up call because when I called them last, they were like, oh yeah, we'll send the check, and they just haven't sent the check yet. And then this year's, I've already started, like January's, I already got, I don't know, like 1,500 back on in the last like 2 weeks. So it'll continue to improve as those things are sorted out on it. Any questions on that? Some of them are interesting. Like I feel like I'll solve whatever's holding up with one insurance company, and then another one will pop up and be like, oh hey, I'm having problems right now. So it's just kind of a whack-a-mole a little bit is what it kind of feels like. But I feel a lot better about the process this year. I feel like even already, I feel like October's numbers are reflecting the improved system significantly. Like we already have a fairly large return from October, and usually it takes like between 3 to 6 months to get a return, but I feel like we already have a good chunk of it, and it's only mid-December, so I feel pretty good about that.
So the numbers through March are probably as good as you're ever going to get.
No, they're not. They're still, yeah. So like, I already turned back in like a handful this last week. So like I've gotten some kicked back. So in the last month I've started fixing a bunch of these that like, I have been working on fixing them throughout the year, but maybe these ones are the ones left. And like, there were some that were not closed loops from like an EMS bill I found that hadn't been closed. So some of it's just QC stuff that I need to do. But yeah, I mean, they are at 90%, so like I feel good about it, but my goal is to get it higher than
Most
that.
insurance companies give us 12 months to bill.
Yeah.
And so Katie usually does do one little last push right before we
Yeah.
Okay.
hit that time of the year, yeah. Any other questions about billing?
Do we know how that compares to other counties?
No. Unfortunately, I don't know. There is a little cohort of people that meet on a monthly basis to talk about billing, and it's certainly a question we could pose to them to see.
I've only been doing this for 2 years, and everyone's asking me for help. So I don't know if that's indicative of how it's going, but yeah, well, I don't know about that, but like it's definitely a little indicative on how much of a struggle this is.
Yeah. It's true. That's kind of, we push to kind of build this group that can meet and talk through billing issues because it is a major problem in health departments. It's very rare to find staff that have been formally trained on medical billing. So usually you have people that are just learning as they go, and that it's pretty common in health departments. So yes, I'd say, and I don't know how much like quality improvement, quality control is happening around billing in most places, but I think we could still ask the question of
totally.
I mean, it would be great to get everyone else like thinking about how much are we actually bringing in based on this. So it's yeah.
A few of them haven't been charging like one group had never charged Medicaid before this year, and that's a big chunk that we do. And so like I would say like, and then like one group has never used like the Part D, and so all of those Part D ones, like I would say our Transact was a huge amount of our billing this year. Like once we got that back online and working, like if you look in my files of all the papers of everybody's stuff coming in, like my Transact file is one of the biggest. It's like that one and like Blue Cross Blue Shield. And several of the, like another group just had not been able to do Blue Cross Blue Shield. So it is kind of interesting because I feel like most of the time when someone's like, oh, is somebody billing that? I would say like 98% of the time I'm like, oh yes, I'm billing them. Whereas like a group of the other ones will be like, no. So that's been kind of interesting to see that there's groups that just ignore whole chunks of insurances and don't bother billing.
Carmen, you have something?
From my experience, if you're at 90%, that's pretty dang good.
Thank you. Great. Anything else on billing?
The 100% part for 2023, just to clarify, that is like, that's to clean up our records too. So on the ones that are too old to continue to fight for, or like they just aren't getting solved, I do like have a write-off policy for those. So that's why those ones show 100%. Some of the parts where it says the balance is reflective of things that we really would not get paid even if I were able to fix it, but some of it is a reflection of the write-offs too. So just to be
Yeah, so our, I mean, ultimately, we do end up at 100% because
Yes.
Katie goes in and cleans up everything. We indicate
Yeah.
that it's been, we haven't maybe quite figured out how to print a report that shows us how much we're writing off,
Yeah.
you know, on a monthly basis, but
for the most part, those ones were at least at like 86 to 90% return. So
great. Okay. So sent out a couple of set plans that Marcia did some pretty minor updates on, would you say, Marcia?
Yeah, just a few
Okay,
adjustments.
so you want to maybe go through what those are, and if anybody has any comments or questions?
Yeah, so as far as the emergency medical countermeasures plan, it was just like a few people's names, and then just adding our portable pod now that we have that. That's really all I changed in that plan. And then as far as the Health Alert Network, I also just changed some names. I made sure Alluvian was in there. And then just updated some contact information for the schools. Otherwise, it's exactly the same.
Questions or comments on those plans? Any concerns?
No.
I'd say those are two plans that we are quite good at.
Yes, that's correct. We are quite good at them.
Okay, great. Do you also want to give a little communicable disease update?
Yeah, sure. So this quarter, you know, COVID has definitely been on the rise the last couple of months. But this quarter we've had about 18 COVID cases, a couple gastrointestinal cases, a couple, or it looks like no STI cases this quarter, which is great. But the new thing that we had was acute myelitis, acute flaccid myelitis, which we've never seen. I've never seen before since we were here. So it was in an
Yeah, go ahead.
it was an 8-month-old. Well, he's 8 months old now. Baby who had this condition. It's not something that's contagious per se. It's something that comes about from having some type of viral pathogen that they can get later. But
It was reported to us from out of state.
yep, from a different state, and they've been seen in our state, transferred to a different state, and as far as I know, follow up, they're doing well. So, but that's going to be reported to the CDC for final determination if it's a confirmed or probable suspect case. So all the paperwork's in the works for that. Any questions?
Probably a stupid question, but if someone moves state to state, who gets credit for the disease?
Well, so that's a great question. So in this case, they're still a Teton County resident, but they were just seeking treatment in another state, so it gets reported back to us. So we get credit. But if somebody actually moves, I mean, it's all based on where their residence is. So if they actually changed their physical address, then they would be in the other state. Yeah.
Thanks.
Yep. And as soon as honestly, anytime a communicable disease starts to cross jurisdictional lines, even from county to county in Montana, the state health department gets involved with things, and certainly from state to state, they get involved.
Yeah, the state of Montana was contacted by our provider in the other state, and they were notified, so.
It was kind of an interesting one. We've also had, so while not enormous numbers with flu and COVID, I mean, we have seen some increased activity in COVID. We've had a couple of outbreaks in long-term cares in the last couple of months. So it's definitely making the rounds.
Yep, and 2 influenza A cases so far this season.
Yep, and we know that stuff gets underreported.
Yes, absolutely.
But so far, it feels like a relatively mild flu season. COVID's still just doing its thing. Questions about communicable disease? Gary sent me a nice article on avian influenza, so we're ready for the next one, I guess.
Just a heads up. Yeah,
Right.
nothing.
With the raw milk. With the raw milk.
Yeah.
That'll be nice.
That too, yeah. Okay, so just a few other updates on some programmatic stuff in the health department. So we completed our community health needs assessment in the summer. We currently have, I think it ends today, there's a survey for the community health improvement plan to a group of stakeholders. I think we invited 35 to 40 people to come participate in that process, and I think so far we have 20 some responses. So that survey will close today, and then we're thinking it's looking like January 14th will probably be our in-person CHIP meeting, where we'll actually go through and set the survey kind of helps us select what the priorities are, and then we'll actually set strategies to help address those priorities in Teton County. So that's coming along just fine. We have lots of support from the state health department to get that project done. So we're looking forward to getting that all wrapped up and having a new CHIP. In addition to that, Teton County was accepted into a cohort for a program called Pathways. So the Public Health Accreditation Board, FAB, as it's called, so accreditation's been around for, 15 years for public health, but it's a pretty big, it's a lot to get it done, and it's been pretty out of reach for a lot of smaller health departments, like the amount of documentation and just things you have to have in place along with the cost of becoming an accredited health department have been challenging. So in Montana, I think there's, what'd you say, 6 or 7 accredited health departments, including one of those is the state health department, and the other ones are all like large ones. Missoula, Gallatin, Lewis and Clark are all accredited health departments. So the smaller health departments really have struggled to complete everything that's required for that, and so FAB created kind of another track called Pathways, and what that is it's not an accreditation, but it is sort of a light version of accreditation to help you get some of those major pieces in place down that path. And so the state of Montana received some grant funding to be able to pull together cohorts, and so they can assist groups of health departments together in a cohort to go through the Pathways process. There's essentially, it's a 2-year program that we're agreeing to participate in. There's essentially 2 tracks. One is kind of building partnerships, like outward, how does the health department work with the rest of the community, and the other one is sort of more internal, looking at our own procedures, policies, procedures, that kind of stuff, making those improvements on kind of a more internal basis. So we get a little chunk of money to do this, and we'll have the support of the state and this other cohort. We're also the second cohort in the state of Montana to do this, which is very beneficial to us because we have access to everything that the first cohort learned. So it will help us, like having a Chana chip is part of, the Pathways program, having an agency strategic plan, having a workforce development plan, having a quality improvement, or performance management system in place. Those are all sort of the pieces of it. And so it's going to be, I think, it's going to be a lift up front to get this work done. But once we get through it, I think it will be a really positive thing in terms of how we operate as a health department. It will help us kind of move towards it becoming an accredited health department and have some consistency in how we do those things in relation to like how other health departments do them as well. So, it's going to be some work, but everyone, when we decided to join, the whole staff was on board with it, and I think it'll go well for us. I think we'll have some good. It'll be a great way to sort of think about how we can improve the work that we do in Teton County. Sorry, that was sort of a rambling explanation of what we're doing, but does anyone have questions about that?
How much funding did you receive in this?
I believe the grant is right around $30,000 a year, and the cohort starts in January.
So that's pay labor, basically?
Yeah.
And maybe travel?
Yeah, like it'll allow us to, there's going to be, I think with that cohort, there'll be, I think maybe once a quarter an in-person meeting, so we'll be able to use that to travel to, we're going to try to convince them that Shoto is the most central location for the cohort to meet.
It was. Sounds good.
But yes, we can, basically we can use it however we feel necessary to help support that work, so. Okay. So behavioral health crisis diversion, just to give you guys an update, I know it's been a little bit slow, the movement on this, but we received that 3-year grant. Well, Pend Oreille County received a 3-year grant in July from the Montana Healthcare Foundation. So this is a 3-year planning grant, and this is on behalf of a 10 jurisdiction region to discuss behavioral health crisis diversion. We had, let's see, so we meet on a monthly basis. We had a SIM map, which is a sequential intercept map, meeting in Great Falls at the end of September, and that we had really great turnout from Teton County. Keith Van Setten was there, Deb Coverdale came, some folks from Benefice, I was really impressed at how Teton County showed up for that. And so that allowed us to start to talk about where, when somebody is in a behavioral health crisis, what is currently happening and where are we kind of falling a little bit short. And we did that with 10 other jurisdictions, or 9 other jurisdictions. So 10 jurisdictions total. So it's a big map, as you can imagine. It's complex to think about how that happens across an entire region. The purpose of the region, the reason we have a region that large is because all of those counties and 2 tribes, they all funnel into Great Falls. So we're all sort of reliant on Great Falls for higher levels of care. But I think it was an eye-opening conversation. As I said, we've kind of just been it's been a little bit slow to get moving with all of this, but just this past week, Amy Shaw, who's the director of the Pend Oreille County Health Department, and I met with a few independent contractors to help facilitate the coalition. So that's a big step also for us to actually have somebody who will have designated time to work on moving this coalition forward. And I think realistically in a 3-year period, we know that crisis diversion is complex. It's really challenging to deal with individuals who are having a behavioral health crisis for a lot of different reasons. I think what we're hoping for is to get a strategic plan in place for the region on how we might want to address this. What can we actually talk through some of the things that we can actually do moving forward in the longer term, and then start to sort of practice working together. And that might be some regional trainings, that might be, a regional rollout of promotion of 988, or working with our dispatches to make sure that they can, work towards incorporating 988 into those calls, that kind of thing. It's probably going to look a little different in every county, but we're hoping if we start to practice working together when we try to roll out more complex strategies to address crisis, we'll be good at working with each other. So that's kind of the hope there. Any questions on crisis diversion? Okay, or behavioral health stuff at all? Behavioral health, I'm quite confident will end up on the chip again this time around. It's an important issue in Teton County, and it continues to be selected by the public as something that they want to prioritize.
We probably do one transfer a month for a suicide.
Yeah.
That's a lot. I mean, that feels like a lot.
Yeah, it is a lot.
It is a lot.
Most recent's a 14-year-old.
Yeah. Anything else on behavioral health? Okay, so some maternal child health updates, just really brief from Mandy. So since July, we have had 17 new households join our WIC program, which is a significant increase. We're probably close to a 25% increase in our WIC clientele. That's just households, not even including number of participants in households. So I don't really know why. I can't really explain it. Just a lot of people have been reaching out to us and wanting to join the WIC program, which has been great. It's been keeping Mandy very busy.
Is that income driven, or is it eligible for anybody?
No, it's income based. So if folks are on Medicaid, SNAP, or TANF, they're called adjunctively eligible, so they can automatically qualify for the WIC program if they have Medicaid insurance. But if they don't have Medicaid insurance, they can show pay stubs, and so there's a threshold. And I mean, every year the threshold increases a little bit, but it wasn't like a significant jump or anything like that. I'm not just a lot of new babies in Teton County, and just a lot of people interested in WIC. So, and then the other thing that we felt went pretty well this summer was our breastfeeding, our lactation station tent. We had it up at a handful of events in Teton County, around 4th of July, over at the Fairfield Swim Days. And then we actually were able to loan it out to Conrad this year too, and they were able to have it at some of their summer events as well. So that was, I think we're happy to be able to share that with folks so that they can make community events like that a little bit more breastfeeding friendly. So I think that's it for maternal child health. And then Brianna's update from the chronic disease programs is that this year our DPP program returned to full recognition status with the CDC, meaning that we met all the requirements. So we had enough participants who attended a certain number of meetings. They met their 5 to 7% weight loss goal, and they increased their activity minutes to 150 minutes a week or more. The next DPP diabetes prevention program will start in February. So we'll be advertising for that in the very near future. Then with our tobacco program, we had Brianna really focused on building some partnerships to do some great sort of tobacco-free family events. So she was able to partner with Extension and the Chamber to do the music series. So those were all tobacco-free in the music by the pavilion out in the grass. What was it called?
Get Your Kicks at 6.
Get Your Kicks at 6, yeah. So those were tobacco-free events. She also partnered with the Trunk or Treat event on Halloween to make that a tobacco-free event. And then with the Shoto Youth Alliance to make they recently did a rock, paper, scissors fundraising tournament event, and that was also tobacco-free. So really trying to target those events that have a lot of families at them to make them tobacco-free activities. So, I think that's it as far as chronic disease goes. Any questions about those programs at all? Okay. I'll go over to Austin.
Okay. I've got one thing to vote on. It's Ron Wilson. He's got a property over on county line or country County Line Road. Over in Fairfield, it's about 9 acres. He's just hoping to put in a shop without doing the work for a septic system. We kind of discussed possibilities with him, and this one actually makes sense for a holding tank. The location he's building is going to be wedged in between 2 wells. So in order to do a system like normal, he'd have to be going pretty far away. It's just going to be a shop with a bathroom. It's not any extra water source from on his property, since he's already got a house with a drain field there. It's just, to me, not very probable to actually put in a regular system. And so that's what these Board of Health variances are for, is if you guys take my recommendation or think that, you know, it's not creating a public health hazard by doing a holding tank, then he can go ahead with it. So I do need a vote for that one, either for or against it, but if you have any questions about it too, I can try to answer
The
those.
recommendation is for, right?
Yeah, I think it would be
I will go for that.
it would definitely be a overly expensive system for a urinal, basically.
Sure. Okay.
Okay, so I think I need a motion and an actual vote.
Yeah, so does someone want to make a?
So I didn't hear enough to make the motion.
So I've got Ron Wilson. He's in County Line Road over in Fairfield. He's hoping to put in a shop. However, the shop's going to be wedged between 2 wells, and so it's not making a septic system very viable. So he's hoping to just do a holding tank instead.
So could I move that?
Yep.
Okay, to approve the variance.
Second.
Okay, all in favor?
Aye.
Okay, any opposed? Okay, motion passes.
Thank you.
Great. Okay, well, that's the agenda, so does anyone else have anything that any questions or anything else?
I'd like to wish everybody a happy holiday season. Safe travels out there if you're traveling.
Thank you.
Thanks.
Same to you. Oh, I guess we do maybe have one other little thing, don't we, Elaine?
I guess, yes. I'm gonna resign from the board, unfortunately, but I'll be 82 in June. My age is catching up with me, so.
Yeah, well, Elaine, we really appreciate your many, many years of service
Yes,
to
thank
to public health and to the Teton County Board of Health.
Yeah, thanks for your notes.
And your minutes.
Yeah.
Thanks.
Thanks, Elaine.
Okay, well, yes, appreciate that, and I'll talk to the commissioners about getting an ad in the paper to find a replacement.
Yeah.
Nobody wants to be secretary, I know that. People will be on the board, but they don't want to be secretary. I think I've been secretary since 2011.
Wow.
As well.
Okay.
Yes, a long time.
Thanks for doing that.
And then I will also be leaving the health department at the end of May. So just so everybody knows. Yes.
Retiring?
Not retiring, I'll be moving.
Oh,
Yeah.
shoot, okay.
Oh, thanks, Marcia.
Yeah.
Look forward to hear that.
Kalamazoo, is that right?
Yep.
Okay.
Kalamazoo.
Kalamazoo.
Wow. I thought you said Michigan, I said Missoula, but Kalamazoo, that's a big difference.
That's a big difference.
Wow.
So if you know any nurses, send them Melissa's way.
Okay, well, with that, we can adjourn our meeting. Thanks, everyone.
Thank you.
Okay, thank you.
Thank you, if you two online.
So Marcia, this
Thanks.
8-month-old,
Thanks, Melissa.
was this kid out of Teton County then? And it was